is metallic irritant poison. So it is a continuation of the last lecture class. Okay, on last lecture class we did phosphorus from non-metallic and arsenic and acute mercury poisoning from metallic. So chronic mercury poisoning, this is also called hydragyrism. That is the term for chronic mercury poisoning. And the clinical feature that we see on chronic mercury poisoning includes gingivitis and salivation. And the second symptom is tremor. And this tremor is divided into three stages. Okay. So the first initial stage is called Denbury tremor. So in this initial stage, the tremor is seen or felt first on hands, then on lips, tongue, and lastly on arms and legs. So that is the sequence of tremor. So I will repeat again: hands, lips, tongue, arm, and legs. And the second stage is called advanced stage, or this is also called Hatter shake or glass blower shake. So in this stage, the tremor is seen or felt while performing or doing physical activity. So physical activity includes while walking, while writing, or while holding a spoon, etc. And severe stage is called concussio mercurialis. So that is the term for severe stage. And in this stage, the tremor is so severe that the person is unable to perform his or her physical activity. And the third symptom is mercurial erethism, or this is also called neuropsychiatric disorder. And the symptoms includes anxiety, insomnia, irritability, shyness, loss of memory as well as confidence, depression, hallucination, and then suicidal tendency increases. The next one is mercurial lentis, and it means there is brownish discoloration of anterior lens capsule of the eye, and which is seen during eye examination. And the next one is pink disease. So hands and feet becomes puffy, pinkish, painful, and there is also presence of paresthesia and peeling of the skin. So that is called, this whole term is called pink disease. And then other symptoms include anorexia, insomnia, sweating, and there is presence of skin rash or irritation and photophobia. So these are all the symptoms of the sign, clinical feature you will see in hydragyrism. And treatment or management. So the first one is always remove the patient from the source of exposure. And the second one is you can give demulcent. And the next one is chelating therapy or agent candles should be used. So either you can use penicillamine or you can use British anti-Lewisite. Okay. So the dose of penicillamine in case of children is 25 to 40 mg per kg per day, and it should not exceed more than 1 gram, and it should be given in 2 divided doses. So the dose should be divided. And in adult, the dose is 250 mg, can be given 4 times until the level of the mercury in urine falls below 5 microgram per liter. Dose of British anti-Lewisite is, so the initial dose is 100 mg, should be given 4 hourly for the first 2 days, and this is followed by the same dose. It should be given 8 hourly for the next 8 to 10 days, and the British anti-Lewisite should be given intramuscular. The next one is metallic is lead. Okay. So metallic leads and its compounds are poisonous. So these are some of the 5 compounds of lead. So lead acetate, carbonate, chromate, monoxide, and lead tetraoxide. So mechanism of action. So the lead binds with sulfhydryl group. Okay, you can see on the picture that is the chemical structure of the sulfhydryl group, and it will inhibit the production of the hemosynthesis and inhibit cellular respiration. And the fatal dose is 20 gram and the period is 1 to 2 days. Acute poisoning. So the clinical feature includes there is presence of metallic taste, dry throat, and there is presence of thirst, burning abdominal pain, nausea, vomiting, headache, insomnia, depression, paresthesia, and urine output decreases, and cerebral ataxia feature is seen in children, and in severe case, death will occur. So these are the symptoms you will see in acute poisoning. And the treatment or management, all first step is always maintain airway, breathing, and then circulation. And the second one is stomach wash should be done using 1% of magnesium sulfate solution. And you can use demulcent. And the next one is magnesium sulfate or sodium sulfate should be used. And the dose is 8 to 12 gram. And the chelating agent can be used. So British anti-Lewicide, dimercaprol, succinic acid, or penicillamine. And the sixth step is symptomatic treatment. Chronic lead poisoning is also called plumbism, or this is also called saturnism. Okay, and the feature includes facial pallor, anemia, basophilic stippling of RBC. So basophilic stippling of RBC means, so when you see or look the RBC under the microscope, on the periphery of the RBC you will see dark blue spot dot. So that is called the basophilic stippling. And the next one is retinal stippling. So retinal stippling means, so when you see the retina or during eye examination, you will see grayish glistening of the retina. Okay. And Botonian line, or this one is also called blue or lead line. So you will see the blue line between the junction of the teeth and gum. That is called the Botonian line. And that is formed or produced due to the reaction of lead with the hydrogen sulfide that is produced due to the decomposition of food particles. So that is the reason of appearance or production of the lead line. And the next one is colic pain and constipation. And the next one is there is presence of wrist and foot drop. Infertility can be seen in both male and female, and miscarriage can be seen in pregnant female. So these chronic lead poisoning features are very important. The next one is copper. It is also a metallic irritant poison. So copper is a metal, non-poisonous, but its compound is poisonous or toxic, and this compound will inhibit enzymes. A copper sulfate, or it is also called blue vitriol, and the fatal dose is 30 gram. Copper subacetate, it is also called verdigris, and the dose is 15 gram. And the use of the verdigris is mostly the verdigris or the subacetate is used by the vegetable shopkeeper to make the green vegetable to look more fresh and green. So they will dip their green vegetable on this solution to make the green vegetable look more green and fresh. Fatal period is 1 to 3 days. And the signs and symptoms. So there is presence of metallic taste, salivation increases, burning tummy pain, thirst, nausea, vomiting, and the appearance or the nature of the vomit is bluish green in color. There is also presence of diarrhea and muscle cramp. And renal symptoms includes oliguria, hematuria, albuminuria, and uremia. And other symptoms includes hemolysis. There is presence of jaundice, paralysis of the limbs, dizziness, coma, and at the end, death. And death occurs due to the failure of the hepatic or renal system. So the treatment first is ABC, maintain airway, breathing and circulation, and the second one is Stomach wash should be done using 1% of potassium ferrocyanate. So potassium ferrocyanate is the antidote of copper. And this will convert the toxic copper into non-toxic cupric ferrocyanide. And the chelating agent can be used. So either you can use British anti-Lewis-side, ethylene diamine tetraacetic acid, or penicillamine. Demulsion should be used. And the next one, in case of renal failure, hemodialysis should be done. Okay. And this is the assignment for you. So you don't have to send me the assignment. Try to make the note of this question. So each and every question is very important. So with this lecture, we have completed the irritant. So tomorrow we'll start systemic poison. Okay. Everybody copy the question.